about predisposing factors. What are these mutagens all about? Okay. Well, it's one of three different things. We could have carcinogens, we could have pathogens, or we could have hereditary things. Things that, you just thank your parents for passing these genes down to you. So, carcinogens. Carcinogens are environmental things that are coming into the body that is out in the environment, right? So we could have a lot of different things. I'm going to speed this up a little because some of them are pretty obvious you hear about all the time. Radiation, right? Sunlight, nuclear weapons, X-rays, okay? Chemicals, insecticides, dyes. Here's a little tip for you. Dyes usually, and it's like dyes in, let's say, factories. You're working in a factory and they work with a lot of dyes. A factory worker working with dyes, usually the big pearl over here is that they usually cause urinary bladder cancer. That's a little tip for you, all right? A little pearl. If you see a factory worker and he has cancer, I mean, they're trying to get, that's an NCLEX exam question. They're trying to see if you could link between dyes, factories, and urinary bladder cancer. It's not always that way, but more cases, that's what you're thinking of. When you hear factory and dyes and you think cancer, think urinary bladder cancer. That's usually what it is. We have fumes, right? Cigarette smoke, that's pretty obvious. I'll talk a little bit more about that in a moment. Industrial pollution, radon, all right? Asbestos for foreign bodies that you're breathing in, right? That can cause mesothelioma, which is a cancer of the lining of the lungs. The diet, as I mentioned to you before, fatty meals, there's an increased risk of getting colon cancer. Also meals with mold byproducts, all right? And some chemotherapy agents. Chemotherapy does kill cancer, but in some cases it actually will cause the cancer. We'll learn more about that when we get pharmacology. And we also have some hormones that will cause cancer. Estrogen is a good example of this. We don't want to just give birth control and just give them, if they want birth control, we can't just give them estrogen. If you just give somebody loaded with estrogen, that may stop certain things, but the problem is you're loading that body up with estrogen. Estrogen can actually make the cells in the endometrium, which is the lining of the uterus, start getting excessive, and that can cause cancer. Also, there's also some studies showing that increasing estrogen can also relate to breast cancer. So we actually throw in with birth control or just hormonal treatment for that matter. We throw in progesterone. Because progesterone will counteract some of the effects of estrogen. We want to make sure that's in there too. Tobacco. So let's talk a little bit about this. It's the leading cause of preventable death in the United States. Okay, the 30% of cancer, all deaths, is because of tobacco, and 87% of lung cancer deaths are related to tobacco. Now, I'm not putting these statistics up here because I want you to memorize 30%, 87%. What I want you to do is to see the trend that may be going on. So right now it's 87% and 30%, but look back on this and see if you hear that it's like 90%, or if all of a sudden you might see that this tobacco stuff related cancers are going down. Maybe in 5 or 10 years you hear it's like 60%, but then you'll remember, I took pathophysiology with Dr. Gamaro, and I remember he's saying like it was like almost like 90%. So you start thinking, well, why is it going down? I mean, look, it's kind of difficult to find places to smoke nowadays. You can't smoke on a plane, you can't smoke in a restaurant. I remember the days when I walked in a restaurant and, they would say, do you want smoking or non-smoking? But, it's difficult to find these places. You can't go in a bar, which is, back in the day, that's obvious. That's the most common place you would see smoking. Have a beer and have and smoke a cigarette. So, so it's making it very difficult to do this. So it's maybe that's the reason. Maybe we're just not seeing many people smoking because it's just difficult to find places to smoke. It's a multipotent carcinogenic mixture in there. So there's a lot of carcinogens that are inside smoke itself. All right. Even carbon monoxide's in there, and we'll talk about that when we get to respiratory. But that's going to make it very difficult for oxygen to bind to hemoglobin as carbon monoxide. It's linked to many cancers, not just lung, but it's linked to digestive tract stuff, the upper GI tract, the liver, the kidney, the pancreas, also certain leukemias. We'll get into leukemias later, but myeloid leukemia it's also linked to. Cigar and pipe smoking is equally harmful. Some people might say, well, at least I'm not smoking cigarettes. Well, yeah, but you got pipe, cigarette, they can still cause cancer, so be careful of that. And the whole thing about secondhand smoke. Secondhand smoke, when someone smokes and there's smoke in the air from cigarettes, then we know that there's 7,000 plus toxic chemicals in there, including 70 just to be carcinogenic. So how do you find out about this? I mean, how do you explain, there's going to be, well, when we get into cancers, or lung cancers, there's 4 types of lung cancers. One of them is there's an extreme connection to smoking. I mean, you really can't get this at all if you haven't been smoking. Then there's also one to the other extreme where it has no linkage to cancer or to smoking at all, and the other 2 are kind of like in the middle. So how do you explain someone who doesn't smoke at all, who gets the type of lung cancer that is linked to smoking? Right? You start asking questions. Are you living with anybody who does smoke? Oh, my husband's been smoking 2 packs a day for the past 40 years. I'm smoking it. Oh, you can't even see through see the curtains because there's so much fog in there. There's too much smoke. Well, they're smoking all this. So that's where this comes in. And our major concern, it's not just that, but our major concern is the children who have no fault at their own. They're just forced to live in a place that has a lot of smoking. So there might be a time later on where, smoking is going to be, I would hope not, I mean, not that I don't hope this, but, it's going to be very difficult to control smoking in the house. So, I don't know how they would ever, say you're not allowed to smoke in the house, but, but you got to be careful with the children. And this is just showing you the effects of secondhand smoke in children and in adults, okay? Radiation and chemotherapy, as I mentioned before, can cause cancer, okay? But keep in mind, radiotherapy and chemotherapy may interfere in or stop the normal mitosis. And that's how it actually will stop the cancer, right? So this may interfere with that to stop normal mitosis. But that's normal mitosis. But the thing is, what happens here is that some cancers are successfully treated with these also. So we got to be careful the dosaging on this. Now, this prevents cancer growth, cancer cells to grow further and kills normal cells. But this explains some of the side effects of chemotherapy when we deal with cancers. We all know that this medication is going to kill cells that are rapidly producing, all right, which is cancer cells, which is what you want it to do. But you also have cells that grow at a very high rate also. Your skin cells. The skin cells, well, hair is a part of skin, so what will happen is it's going to kill off the cells of your skin, which means your hair is going to fall out, which is a common side effect of this medication. Look at all the kids that are bald. That's the reason why. It also is going to kill off the cells in your stomach and intestines, the lining of the epithelium of these digestive organs. And it's going to kill those cells that are lining these organs, the internal organ or the internal cavities. So it starts tearing away those, and now the underlying tissue is exposed to this acid that's in your stomach. So you start getting nauseous. You start vomiting, which is another reason, another side effect that's very common during chemotherapy. You've seen that, if it's not, unfortunately, your own family member, but you've seen it on TV and stuff. The bald kids, they're just vomiting up a lot. That's why it's happening there, okay? So again, I'm trying to show you, there is some memory in any course you take. I realize that. But a lot of it, like the signs and symptoms, they make sense. you understand the mechanism of either that disease or the mechanism of the drug, it makes sense. Okay? So that's why we got to be choosy about the exact dosage of that chemotherapy, because you don't want to have too much of the side effects that it's going to destroy your good cells, right? We also have pathogens, right? Viruses, as we talked about this. Viruses carry RNA and DNA, and they can get incorporated into the host cell, which would be your cells, right? And these could actually turn on oncogenes, all right? And which means that these cells will produce much more rapidly than the simple normal mitosis. And these are the ones that you should know that would cause cancers. HPV, human papillomavirus, you know that causes cervical cancer. That's what we see all over the commercials and stuff. But HIV causes Kaposi sarcoma, right? It's a blood vessel cancer. If you've seen Tom Hanks in the movie Philadelphia, and he had these skin lesions that appeared and they kind of disappeared. What that is that they are tumors of this Kaposi sarcoma. These are tumors of the blood vessels where they get really big and they get closer to the surface of your skin, but then they kind of move down and disappear. And then other places they resurface. That's what Kaposi sarcoma is. Hepatitis B virus, HBV, that causes hepatic cancer. And Epstein-Barr virus, the same virus that actually causes mononucleosis, a different strain of it can actually cause a type of lymphoma called Burkitt's lymphoma, but also nasopharyngeal carcinoma in the nose cancer. Okay, but I don't want you to think if you have mononucleosis, I'm going to get cancer. No, it's a different strain. Okay, and of course heredity, right? This can also, just knowing that your family has, certain family members have cancer, they can pass that gene down, right? So you get this you inherit this damaged DNA from your parents, right? That's why family history is key. Immediate family for cancers is much more important than distant families, right? If great-great-grandma had lung cancer, that doesn't say much about if you're going to get cancer. What we're looking at, does mom have cancer? Does your sister have cancer? The immediate family, that spends more time, at least when it deals with cancers. Okay? Presence of certain genes. The BRCA gene is probably the more common one, or the easier one to talk about. BRCA, BRCA, which stands for breast cancer. We have a BRCA1 gene and BRCA2 gene. And knowing that you have this gene increases your risk for both breast cancer and or ovarian cancer. Okay? So breast and ovarian cancer are increased if you have these genes. Okay? Be careful with this. As I talked to you before, getting yourself tested for this. Now, you got to do something with it, or you have some kind of intention of doing something with this. Is it helpful? I don't know. I mean, if you know that your mother has breast cancer and your sister has ovarian cancer and your other sister has breast cancer, do you have this BRCA gene? Is it something where it is a strong correlation? If you get tested for it and you have it, well then what are you going to do with it? Because it doesn't mean that you're going to get ovarian cancer or breast cancer. It just means that you're going to have a higher risk. Right? So, I mean, if you want to do something about it and say, hey, look, I carry the BRCA gene, my whole family has cancers, ovarian cancer and breast cancer, so I want to actually get a bilateral mastectomy, and I want to get my ovaries removed, and since while you're at it, might as well get the uterus and cervix removed also. So right there, you're getting rid of 4 different cancers. And believe it or not, health insurance would actually okay that, okay? So you got to say, what are you going to do with that information? The other thing is, if you find out you do have the BRCA gene, or you carry it, then you have to divulge that to your health insurance and your life insurance and your disability insurance. Because now you're at increased risk of getting these diseases and costing them more money, let alone you're going to die at an early age. So if you know that you have the BRCA gene, you're going to have to tell them about this. If you end up getting ovarian cancer and you know that you have the BRCA gene, the insurance company might decide, well, we're not paying for it because you knew that you had this BRCA gene and you were supposed to tell us, which means that your premiums would have went up, but you chose to evade that by not telling them. They could go back to your records, the medical records, and find out you did get tested for this and came back positive. So be careful. Just understand, what are you going to do with each test? And I'm not just talking about here. If you become a nurse practitioner, you got to think to yourself, okay, I want to get a hemoglobin test. Okay, if you get a hemoglobin test, don't just do it for the fun of it. All right, I don't want to say it's fun, but the thing is, why are you doing this? Is it going to change your management? If it comes, do you expect it to be low? Do you expect it to be high? If it is, then what are you going to do? Are you going to give a blood transfusion? Are you going to do plasmapheresis? You're going to remove some red blood cells? I mean, do you expect it to be changed? So keep in mind, just don't do lab tests because they're expensive. You know, lab tests, they start piling up. I mean, vitamin D blood tests can cost like $250, $300. All right, you do that. What are you going to do about it? What's the purpose of that? So just understand that, you know, what are you going to do with each test, with lab test, X-ray, or whatnot. All right, so this is just kind of showing you the three ways of getting these mutagens, what can cause cancer. Carcinogens, hereditary, and pathogens. And this is kind of showing you factors believed to contribute to global causes of cancer, so worldwide, and they kind of put it all in here, okay? Hormones and infections and smoking and so forth.